Hey folks, Niki Ramirez here, the founder and principal consultant at hranswers.org. Today is Friday, July 15th, 2022. I'm coming to you from the road, out and about for an HR conference this week, HR Unite Michigan. And during the week, some interesting information was released that's relevant to small businesses and COVID testing. So if you are in a non-healthcare setting and you are from time to time or regularly asking employees to engage in COVID testing and provide you with the results, this information is for you. So I wanted to simply share a quick update. So the EEOC, the Equal Employment Opportunity Commission, that's the federal agency that is mandated to oversee claims and charges of discrimination and harassment in the workplace. They are guiding in terms of what is appropriate for workplace COVID testing in alignment with employee privacy rules related to medical conditions. So a little bit of a funny path there, but I wanted you to understand how we get to where we are today. Employers with 15 or more employees are subject to the rules and regulations under EEOC's mandate under the Civil Rights Act of 1964, Title VII. So probably too much information, but I want you to know where we're coming from. Lots of states have rules that apply at lower employee count thresholds. So if you'd like to get a little bit more of an understanding of the rules and regulations that apply in your business, please reach out, drop a comment or a question, let us know. Okay, so back to the testing update. So the EEOC says over the course of the pandemic that it's been okay for employers to mandate that an employee get tested for COVID and that employee share back the results of that test. Both in cases where an employee may have been symptomatic or some employers have implemented regular testing in the workplace and asked that employees engage in screening tests. So these tests are for folks who are likely asymptomatic, don't know that they may have COVID, and so we're testing preventatively to ensure that we reduce the instance that an employee might share COVID with a coworker or member of the public, a client, a customer. So the EEOC's new guidance says that employers are going to be allowed to continue to engage in mandated workplace COVID testing, but only where it's a business necessity and, essentially where it makes sense. So first thing, an employer could ask an employee to engage in testing and supply those results back to the company if the employee is symptomatic, if they're presenting symptoms of COVID, and they, there's a high likelihood of maybe they have COVID also because they've been exposed. So there's a known exposure. Maybe they attended an event where an attendee was later confirmed to have COVID, or, spent time with a family member or a friend, things like that. So if you have a known exposure or an employee is symptomatic, then of course the employer could ask the employee to get tested for COVID. There's more information on what type of test to get, things like that. We're not going to dive into that in this particular message in this video. So aside from folks who are symptomatic, employees who are symptomatic or have a known exposure, when else might an employer be allowed to continue screening in the workplace? So if an employer has employees who are in contact with the public or a large number of other employees, direct contact, spending some time with folks, doing training, coaching, education, transactions, whatever it might be, an employer can ask for employees to continue to participate in screening. So again, asymptomatic preventative screening, if the employee is unvaccinated, perhaps. And another piece of that's interesting to consider is whether or not there's a high rate of transmission in the area where the employee is physically working. So employees who are unvaccinated might be asked to continue to engage in workplace screening, as well as folks who are in areas of high transmission and are unvaccinated. So that guidance comes from the CDC. And so the Centers for Disease Control provide us with that information about the testing scenarios that might be appropriate. The EEOC is continuing to guide us on what might be an appropriate ask from an employment perspective. So we're just combining those couple of trusted resources to say, okay, middle of July 2020, where are we at? What makes sense? And how can I keep my business, out of hot water? And then also, how can I work with my employees to engage in updated policies and practices that make sense for where we are today? So I hope this information is helpful. If you're engaging in COVID testing in the workplace, which lots of employers still are mandating COVID testing in different scenarios, we're here to help. Our team of HR experts is ready to answer questions about crafting policies and procedures that work for you in your workplace setting. Again, we were talking about this from a non-healthcare workplace setting. I can't even remember if I mentioned that, but this is for non-healthcare workplaces. If you work in a healthcare work environment, there's a sort of a whole different slew of rules and regulations, or rules and recommendations that might apply. So we dig into it in detail. Questions are always welcome. We're happy to be connected, and we're wishing you a happy and wonderful day. Take care.